doing live a little early this morning. We're on spring break, getting ready to travel and trying to get stuff done before the kids wake up. So I have a little story to share with you. Our border terrier, Abby, as you guys know, we took her for her first formal grooming last week. And I want to share this story that will, it just literally, it took a friend of mine to be like, yeah, that's totally what happens in pelvic floor PTD. I'm like, oh, wow, you're right. So we took her to get groomed, and the type of terrier she is, hey Jill, she is like a wire-haired terrier. And so they have a couple coats, and when their hair gets long enough, it's just dead. You just pull it out, right? And so we did the best we could for a couple years and finally got her groomed. And so we volunteered to have her be a part of this education session. So they learned how to, these groomers were learning how to hand strip is what it's called. And so I stayed with her. And I was petting her and kind of soothing her and calming her. And the woman instructing, she saw me brush her coat backwards. And coats in this type of breed, like they go in one direction and it feels weird. It's a little bit against the grain, so to speak. And the woman immediately stopped me. She's like, don't do that. You can strain her blah, 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 whatever muscle. I really didn't catch it, nor does it matter. And really reprimanded me for potentially straining her blah, blah, blah muscle. And I was like, oh, and fortunately I had a mask on, and like, I kind of almost started to laugh because I was like, oh my God, this is such bullshit. This says nothing about groomers or terriers or dogs or anything. Because here's the thing. My dog's breed, they're supposed to go into rat holes, okay, and get out vermin. And so, yeah, you're going to go with the grain going in the rat hole. But guess what? At some point, you got to come out of the rat hole, right? And her hair is going to get brushed in the opposite direction. And I'm damn sure that she's not going to strain her little hair muscle coming out of a rat hole, because the bigger thing is her getting the rat, right? And so I was telling my friend Lauren this, and she's cracking up because she's like, oh my God, this is exactly what happens with our clients, is they're told, oh my God, you'll hurt this. Like, don't lift with prolapse, don't run with leakage, don't breathe wrong. We're not that freaking delicate. Like, seriously, we're not. And I think I feel far more confident saying this, sitting here now, 23 years into practice. The research has changed so much, having kind of gone through this stuff myself, but we really have to re-examine what we tell our clients. And if you're a client, what somebody's telling you. And it's hard because usually these things is you're scared and you think something's wrong with you, and it's the fear that drives the fragility, right? And so again, I have a really scrappy dog. She's supposed to go after rats and vermin. She ain't delicate, okay? Brushing her once or twice the wrong way, she's fine. I promise you, she's fine and didn't even notice. We are the same way. We just have to find that pathway to get us back. And here's the other thing that we've got to remember too. It's only recently that a lot of this research is coming out and it's getting better. It's only recently that we have pro-women athletes that are competing postpartum and raising awareness that we can do things. Women have been doing this stuff for a long time, but we're finally getting some visibility behind it. We're finally getting some awareness that women can perform postpartum, that women should expect to have this tolerance. Jill, yeah, a lot of scare of the device, not evidence-based. Yes, totally. And again, I think in the lack of evidence, it's really hard to kind of find your way. And I'm saying that as a provider who's been in this space for 23 years, has had symptoms of prolapse, has had leakage, pelvic girdle pain, all the things, diastasis recti, and that's why I think for me, it's become such an important thing to bring this up, because I was right along a scare tactic too. Don't do this, don't do that, don't do whatever, because that's what we thought. And then when I was in that situation myself, I'm like, well, this is crap. I'm not going to tolerate this. And I did the things that I was told to do. And I'm like, well, this isn't working either. There's got to be a better way. And so this all goes to say, 1, we need more research. 2, we need to have conversations about this more. 3, we need to question the advice that people are giving us and what evidence actually means, okay? And there's a lot of voices out there in a lot of different spaces referring to evidence as like an abstract from a conference presentation. No, that's like crap level of evidence. So question the advice that people are telling you. Tell me more about that. Now, had I actually cared in that moment, I would have challenged her a little bit and been like, hey, can you tell me more about this blah, blah, blah muscle and why you think that my dog who goes after rats is so delicate? But I really just needed to get her groomed, and they were doing it for free on a Sunday, and then they had to get her cleaned up. And so they still had to groom her more where we were paying her on that Tuesday. And they did a great job, don't get me wrong. But really, again, we're not that delicate. We need better evidence. Question your providers, and providers, listen to what you're telling people and question that. So that's my 2 cents going into spring break. Hopefully I can get a little bit more done, and before I go home, the kids wake up. Hello, Finland, how are you? Everybody's up early. I should get up this early more often and go live to you guys. If you have any questions about this, whether it's fear, fragility, good evidence, where to get good stuff, or even questions about border terriers and hand stripping for that matter, hit me up in the DMs. I'm happy to chat about it. Have a great week. The sun is finally shining after a week, and I'm going to go check it out. Take care.